Hey everyone, it's Technique Tuesday, and I found myself doing this self-care technique while I'm sitting here catching up on office work and stuff for my business. And sitting on the computer, a lot of times your neck will start to ache and your hips. So today I'm going to go over some self-care you can do for your neck to help prevent headaches. Obviously, there's different types of headaches and different causes for headaches. One being make sure you're hydrated. And I posted an article that kind of talked about gel water and your myofascia on Facebook. It's a super interesting article if you want to go read that. I highly recommend it. So I've started putting chia seeds in my water, making gel water. And yeah, so I like it. Anyway, I'm going to go through some self-care techniques that I use to keep my neck stretched out and limber and functioning properly. So, first I just start with a stretch, and you can really stretch it out really good if you just kind of grab right below your collarbone here. So here's your collarbone, and you just kind of put your hand there and hold. Keep your jaw closed. And you just kind of stretch that out. You have a muscle called your platysma, and it kind of goes from your cheek down to here, and it's kind of like a little blanket going over your other neck muscles. So then you do the other side. Okay, and then that allows you to just kind of get into these muscles that kind of cause some headaches in like the temporal region, around the eyebrow, back of the head, suboccipital area. So a lot of times your upper traps, and I'm gonna try and make sure you can see it. So there's my upper trap. So you can kind of fit your thumb, there's like a pocket. You can fit your thumb in that pocket. And then just put your other four fingers kind of behind there and feel around, and you can feel sometimes, like, a lot of people have trigger points in here. And you just kind of stick your thumb in that pocket, and you can kind of roll it forward, and then, there's trigger point. And that's kind of like going around here. So when you find a spot like that, you just hold it. And it doesn't need to be a lot of pressure. Work to your comfort level. If it's super intense, back off a bit and then let that dissipate, and then give it a little more pressure, and then a little more, and then some movement until it's not radiating anymore. Okay. And there's a few trigger point areas in there, but you just basically, I like to have my thumb in the front, and you can get more pointed if you just want to use one finger in the back, or two. You can get to that lateral upper trap. And you can do the other side. So kind of feel in, and it kind of makes like a little hood that attaches to your C3, C4 right in here. So you just put your thumb on the front side, and that goes right up into my temple. So you just hold it. You can easily do this sitting at your computer desk. I do it while I'm driving at stoplights. Probably not the safest, but yeah, so. And I don't really have any trigger points right now, right here. I've been working on a patient who was getting temporal headaches really bad here for over a year. And so we started off with the upper traps, and she had lots of trigger points in there. And we worked through that. Now she doesn't have any more trigger points in the upper traps. And so we're moving our way up here. In this last session, we just spent a half hour on each of her SCMs and anterior scalenes. So this muscle, your sternocleidomastoid, runs from your mastoid process down. to your clavicle and your sternum. It has a long head and a short head where it attaches. And so this guy has a lot of trigger points in it that kind of go up the back, in the temple, kind of to the eyebrow. And so a lot of people have trigger points in here. And you can just kind of grab when you find a spot. So it's kind of in a shortened position when you turn your head to the opposite side. And then you can really get a hold of it. And you can feel around. You can also lean back when you work it, and then that's actually easier for you to get a grip on. So just kind of turn your head. And you'd be amazed how relaxing trigger point work is. I was working with a patient, like I go and get a 2-hour trigger point neuromuscular massage from my mentor, and I met her at one of David Kent's neuromuscular trigger point seminars, and she's in Lincoln. I've never found anyone else who does this kind of work, and so I drive to Lincoln once a month for 2 hours, a 2-hour trigger point massage, and she spends most of the time on like my neck and my stomach, and then we'll do some other stuff. But 2 hours a month of trigger point is really all I need. And so you just kind of grab the muscle. You can see my SC in there. And I kind of pull it away. You can kind of grab the outside of it. When you feel spots that radiate, just stay there. And if you feel like it's taking a long time, it can take up to a couple minutes. But if it's taking a long time, or if it feels like it's lessened but it's not quite gone, just try and move your finger around. And I can usually feel, even when a client says, oh, it's gone, I'm like, no, it's not. And I'll move just a little tiny bit, and I'll ask them if it's there again, and they'll be, oh yeah, it's really intense. So you want to make sure that you just are right on it, because if you're on the edge of it, you might kind of feel it, but it's not very intense, so just kind of move around. So, and you can work that whole muscle. Now, obviously, there are endangerment sites in the front of your neck, like the carotid artery and whatnot. So if you feel a pulse, like there's a pulse kind of right, there's a little triangle here. So there's a pulse like right in here. So don't go digging around in there, okay? And there is like a vein, your jugular vein, that runs up. And so if you feel a pulse, just scoot over. But it's pretty self-explanatory. You can pretty much find that muscle very easily. And those are two main big muscles that cause headaches and take the brunt of the weight from your head. Now, there are littler muscles beneath those that I personally work on myself, and I help my patients with. That's something I would recommend having a professional do, but I'll just kind of show you. So after I loosen those more superficial, bigger muscles up, I go under the SCM and into the anterior scalene, which is right on top of the vertebrae, the spine. So right there, so a little bit. And that goes up into my temple as well. So this is kind of where you have to make sure that you're medial to the vein. And then I even go and get splenius capitis longus coli. So I kind of displace the trachea here. And get right on the medial anterior aspect of the spine. And this is a lot lighter work that you need, but it feels really good. It's a little weird at first. You're like moving my throat around. But if you've been in car accidents or just have that forward head posture a lot, it really makes a huge difference. These are all good muscles to work if there's headaches involved too. And obviously, if none of them are triggering into the head, then I would say that there's not necessarily a myofascial component to those headaches, but a lot of times they are, and it is definitely has to do with the myofascial trigger points that can alleviate those headaches. So it's always good to get that checked out. So then obviously a lot of times you feel the pain in the back of the neck, so you want to give the back of the neck some love, and I recommend leaning back on the chair when you do that so that your head can relax, and you just kind of sink your pointer finger, I like to use my pointer finger because it's smaller, into that crease at where your skull and your spine connect. And those are your suboccipitals. There's like 4 attachments there. So I lean back, feel in here. And when you feel a good spot, you'll know the good spot, so you just kind of hold it there, back and forth. You can move down the spine. So there's some self-care tips for your neck, headaches, and obviously work in the front of your neck at your own caution. But I kind of showed you the muscle, and if you feel like you need to check with a doctor, obviously I'm not a doctor, please do that. And I look forward to hearing your guys' comments below. If you try this out, let me know. And have a great week. Take care.